Good morning, YouTube. What's happening? Hey, today I have a pretty juicy story for you. And you're probably kind of used to these because the WHO and Anthony Fauci and the New England Journal of Medicine have been at odds with each other for a while now. And we got another good one this over the weekend here, late last week. The WHO put out a study saying that Remdesivir, one of the main antivirals is used in COVID-19 inpatient treatments, doesn't work. Basically, there's no benefit, there's no mortality benefit. And so I kind of want to go over that stuff today. I think it's pretty interesting. And I'm going to try and do more of these kind of like health news stories because I think it's a really interesting time, and I'm going to go through a lot of stuff here, and I'm going to try and keep these videos about 10 minutes. So I'm going to speed through some of it, but you'll see at the end really that there's a message here that's not so much like who do we trust, but can we trust anybody? So let's check this out. All right. First, let me go to see if anybody is on the chat. What's happening? We have like 2 people on the chat. I don't know what happened. So hopefully maybe it's going. All right. So sometimes the beginning of these videos don't work. So anyway, hopefully you guys got this. All right, let's check it out. So here's the study, so this is from Medscape. It was published the 16th. It says Remdesivir does not reduce COVID-19 mortality, study says. So I'm going to talk about some interesting things here. So this is essentially the publication, and then here is the actual paper that was written, revised October 15th, purported antiviral drugs for COVID-19, interim WHO solidarity trial results. So basically, the solidarity trial was a consortium, lots of international committees, so lots of countries: Albania, Austria, Belgium, Brazil, Finland. You can see how many countries are in here. Anyway, so we'll go here and say basically we'll look at what they looked at is actually a couple different drugs, and study drugs were Remdesivir, Hydroxychloroquine, Lopinavir, and interferon beta. And basically the results were 405 hospitals in 30 countries, 11,000 patients randomized, okay, by the way. So you had 2,700 to Remdesivir, which we'll see in the New England Journal of Medicine one, there was only 1,000. And hydroxychloroquine and these other ones, okay, I'm not going to really pay attention to too much of these other ones because the main ones we're talking about is Remdesivir. So conclusions: these Remdesivir, all these other drugs appeared to have little or no effect on hospitalized COVID-19 patients, as indicated by overall mortality, initiation of ventilation, and duration of hospital stay. So that's an important one. Duration of hospital stay. We're going to see in just a second. Mortality findings contain most of the randomized evidence on Remdesivir and interferon are consistent with meta-analysis of mortality in all major trials. So I went through this whole study here. I'm not going to go through it on this video here, but you can kind of go through it if you want and take a look at basically what they did. Interestingly, there's not really a lot on the patients themselves. There's a little bit like the age and like they have diabetes, and that's like it. So it's kind of tough to say, but I think let me switch over. I think the thing is like any of these studies, if you know research, you can go and pick apart lots of different things in these studies. And I don't think that's quite the message that I want to get. I don't want to go through these studies and say, oh, this is wrong and they should have put this and they don't have this in here. Like, okay, these are lots of researchers. It's from the WHO. Okay, probably they were doing the best they can, and this is what we have to deal with. And this is kind of medicine too, because none of this stuff is perfect. Okay, all right, let's go back. So then we go to this is Remdesivir for the treatment of COVID-19. This is the final report. This is saying that Remdesivir works, okay? So the other one said mortality, we talked about mortality and days to improvement. This is an interesting study. So this is 1,000 patients. It's in the United States mostly. It's mostly like, I think it's 60-something% white people, 20% black, and then other, Hispanics and stuff like that. So possibly a different type of person, but again, I don't want to pick these apart. I do want to talk about, let's see, where is it? So they're saying the Kaplan-Meier estimates of mortality were 6.7 with Remdesivir and 11.9 with placebo. Okay, that's one. The estimate. In this paper, I cannot find any numbers of actual patients died. So I don't know what that means. So you're estimating the mortality. Okay. Second, those who received Remdesivir had a median recovery time of 10 days, okay, as compared to 15 days without Remdesivir. So that's the other study was saying basically there's no effect on hospital initiation and duration of hospital stay. This is just saying recovery time. So they're a little bit different, right? So we don't know. My point is like, number one, this is a little bit different. So is there a recovery time? Like, is there recovery time benefit? They're saying yes, but is there a mortality benefit? Like, that's a different thing, right? Like, a lot of these physicians are saying, well, we need to save everybody and we need to like have these medications that like we don't kill everybody and blah, blah, blah. So mortality benefit is different than obviously helping somebody with their symptoms. And, does Tylenol and Advil help you with symptoms? Yes, I can tell you that it does because I took it myself. I wasn't hospitalized, so it's a different patient, right? So anyway, you get where I'm going with this. Anyway, okay, let's go back. Okay, so here's another one. This is effects of hydroxychloroquine in hospitalized patients with COVID-19. This is New England Journal of Medicine. This one was also New England Journal of Medicine. Okay, what do they say in this one? The main conclusion, hydroxychloroquine did not have a lower incidence of death at 28 days. Straight up, here's the death. Okay, all they did was death within 28 days. That's all they looked at. So why were they looking at death only with one and not with the other one? Weird, okay? I don't know. That's not the point. That's not the point. My point is coming, okay? So, all right, let's go back. Why did I have this? Oh, this was the Henry Ford study, okay? This was a Henry Ford study. This is, when is this? August 1st. Treatment with hydroxychloroquine is azithromycin in combination in patients hospitalized with COVID-19. And basically, Henry Ford says, where is it? Results, conclusions, multi-hospital assessment when controlling COVID-19 factors. Treatment with hydroxychloroquine alone and in combination with azithromycin was associated with a reduction in COVID-19 associated mortality. Okay, so they got absolutely destroyed for writing this paper. And then, and this, I went to residency here, so I'm a little bit biased that they probably did the best that they could and they wrote a pretty good paper and they have a lot of sick people there. And so they were addressing mortality with these drugs because they did it early and that's essentially like the drugs that everyone was looking at, right? So that's what they looked at. And then after they got destroyed, like 3 days later, August 3rd, when did they publish this? August 1st, 2 days later. Essentially, they write this, here, I gotta put it up here. Essentially, they write this letter to the community, and the whole thing is like, hey, we did our the best we could. We know it's not a randomized control trial, but we couldn't do that. We just had a bunch of sick patients, and this is what we decided to do. And they said, unfortunately, the political climate that has persisted has made any objective discussion about this drug impossible. And we are deeply saddened by the turn of events. Like, they're just like, hey, we're scientists, we're trying to do the best we can. It got politically charged, and now we can't even write any papers on this because we're going to be destroyed by like the community. So that's kind of disappointing. Okay, so I guess my audio went out because my batteries died. Anyway, so let's get to the point. The point of the video is that you just saw that the WHO, Anthony Fauci, New England Journal of Medicine, Henry Ford, 900-bed hospital, does tons of research, all basically disagree on various things. So my point of the video is not really to say these guys are right and these guys are wrong and these drugs work and these drugs don't, but it's to say this is how medicine kind of works. And nobody really understands, especially new things, what's going on. And it takes a lot of time and lots of research and many papers, not just like one paper, to be like, oh, this drug is the holy grail. And so I think when you start to do that, then you get in trouble. And we don't exactly know what's going to work until you have enough time. And sometimes that time is 10 years. I've seen drugs like be the gold standard, in 2000 and 2010, people say we're killing people with this stuff. And in fact, opioids were like that. Opioids, like they put out a bunch of data to say that opioids were not addictive and they're the best for pain relief and all this stuff. And then basically everybody knows what happened with opioids. Like we have this huge problem now with addiction. So, so the last part of this is something you want to look at here, which is YouTube bans coronavirus vaccine misinformation. Okay, and then our article basically goes to say what YouTube's going to do about it and who's, how they're going to do it and blah, blah, blah. So my point here is that if the New England Journal of Medicine, Anthony Fauci, Henry Ford, and the WHO cannot agree and they don't know what's misinformation and what's not, how does YouTube know? How does Facebook know? How does Twitter know? Who are they? Who at Facebook and YouTube are banning these things? Is this a 10-year-old? Is this a 20-year-old intern that is like, or is it AI? Like, who's doing it? I think we should know, right? So this is the crux of the whole video. This is the reason I wanted to make this video. I'm not saying this works, that doesn't work. Trust this person, trust that person. This is how medicine is. But I am saying, why are more people not asking this question? Why are these social media companies deciding what's misinformation and what's not when the actual medical community doesn't know? That's the question for everybody. Anyway, I hope you guys like these videos. Sorry about the screw up there, the live, but we'll fix that. And yeah, if you like these, please subscribe and definitely hit the like button if you do like it. If you don't like it, you can hit the, unlike or the thumbs down or whatever it is. And share these videos if you would. That'd be awesome. And I'll see you in the next one. Take care.